More than 8 years after BC declared a public health emergency, the province's toxic drug crisis rages on. Thousands of people have since died, most of them from the highly potent opioid fentanyl. And now new data shows just how much of it is flowing through the streets of major cities. Here's CTV's Kamil Karamali.
Most days, it's tough to miss the overt opioid use on Vancouver's streets.
A lot of product comes through the ports of Vancouver.
Now, new data shows the greater Vancouver area far outpaces other Canadian cities when it comes to fentanyl use.
It's this magnet that draws people in.
Statistics Canada measured norfentanyl in wastewater across the country. That's what forms after fentanyl is broken down in the body. It found Metro Vancouver had 4 to 5 times higher levels of norfentanyl on average compared to other cities. At its peak in the 2-year time period measured, Metro Vancouver had more than 46 milligrams of norfentanyl per day for every 100,000 people, roughly 8 times more than Edmonton and Toronto. By the end of 2023, an even bigger gap, with Metro Vancouver measuring more than 10 times the amount of norfentanyl.
People that I work with, they use fentanyl every day, no matter what. What fluctuates is how much actual fentanyl is in the drugs that they're buying. Your drugs are going to contain, on average, 3 to 6% fentanyl.
It's been more than 8 years since BC declared a public health emergency over the number of opioid deaths. Since then, more than 15,000 people have died from toxic drugs in the province. Police have displayed one drug bust after another, but still the toxic drugs continue to flow through the streets.
When the police seize a drug supply and shut down dealers, that causes both increased violence as gangs and others will fight for that territory, and it removes safer options from the drug supply.
The Federal Mental Health and Addictions Minister's Office told CTV News it'll continue to support provinces, although would not provide any specifics. Meanwhile, advocates continue to call on more harm reduction sites and legalization. Kamil Karamali, CTV News, Toronto.